work. Now, 9-year-old Lesley Chepchirchir is a child with big ambitions. She wants to be a pilot, but as it is, she cannot stand or walk as she should. Lesley has a condition known as scoliosis, a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. The good news is that Lesley is at a prime age where her condition can be treated, but she needs all the help she can get for an operation in India. Her only wish is to get better and go back to school in Eldoret.
Happy today, so happy. In Jesus' name, I am happy because I am second with my sister. I am happy, so happy today. Mimi naitwa Lesley Chepchirchir, niko na 9 years na nasoma Benef Junior Academy. Niko huko Eldoret. Dada anafanya kazi ya mafuta, mama anafanya kazi ya duka. Nataka kuwa pilot.
Kwa nini pilot?
Niendeshe ndege.
When you meet Lesley for the first time, she strikes you as a regular child. But when she starts to walk, you notice something unusual with her gait and stature. She is a bit short for her age. It is her Aunt Paris Kemboy, also her guardian, who with the full consent of her parents shows us the problem with Lesley.
The parents noticed when she was around 4 years old. And since she was born, she had a problem with coughing and congestion of the chest, but nobody knew what was the real problem until when they went for an X-ray.
This was at the Moi Teaching and Referral Hospital in Eldoret. Lesley was later treated at the Kijabe Hospital for 3 years.
Waliniingisha tu kwa hiyo kitu ndani. Sasa nilikuwa natembea, nilikuwa nasikia tena ni uchungu. Nilikuwa napumua haraka.
Being treated until when the doctor said he cannot do more because it was something complicated.
Good evening, Joy.
Dr. Ritesh Patel, an orthopedic and spine surgeon at the Spine Clinic Africa, tells us that parents need to pay close attention to symptoms in children before they reach puberty. Children who habitually lean to one side or the other, one shoulder sits higher than the other, a shoulder blade may protrude, a lump or hump on one side of the back is another sign that your child could have a curved spine. In adults, there is a bump in the lower back, weakness or pain in the legs, trouble walking, trouble standing up straight, and loss of height.
Mostly the curvature grows in abnormal at the growth spurts after puberty. So whenever the boy or girl crosses the age 13 or 14 years, if it is having a minor curve, it will grow tremendously.
There are 3 categories into which the different forms of scoliosis fit: idiopathic, where the cause is unknown and no single factor contributes to the development; congenital or at birth; and neuromuscular.
The spine is covered with 2 lungs, right? So when it comes to one side, it compresses the one side of lung. That will create a difficulty in the breathing capacity on the one side. And because of that curvature, the real height will not increase.
On Monday, on a Tuesday, on Wednesday, she cannot. She cannot even wake up. Or if she goes to school in the morning, in the evening, she's so tired, she cannot even sit and eat.
Life-threatening because of the secondary complication. Because the curvature itself cannot threaten the life. But if the curvature is too big, then it can compress the lung, it can compress the heart, and then the secondary complication like difficulty in breathing and some COPDs and some other disease, and which leads to death.
Paris brought Lesley to Nairobi to seek more specialized treatment. After more CT scans and MRIs, she was advised to seek more specialized treatment. Their option now is a corrective surgery procedure at the Apollo Hospital in India.
We cannot afford to take her to India because it's too expensive for us. It cost 4.6 because the doctor told us it's around 5 surgeons who will deal with it.
The people who are not really affording the prices, rather than flying to any other country, better to do it here. Bringing one person, the expert person, and do the surgery locally is more cheaper.
But the good news is that it can be treated, especially in the premium age of 10 to 15 years for girls before they start their menses.
Whatever the age, once you first notice the curve, then make it into the notice of the doctor and start doing the brace treatment. Machinery systems are very, very good for us for the precise placement of the screws.
Lesley's family has fundraised 500,000 shillings. The NHIF will cater for 500,000 shillings, but it is still not enough.
When you do the corrective surgeries by the rotation, normally what we do, see, this is the curve like this. Now by putting the screw, we rotate it. So the compression has gone. Like it is, one side it is convex, one side it is concave. So the convex side you should have to compress, and the concave side you have to distract.
So all the time she complains that she's not like other kids, and she always says, I want to be healed so that I may go to school when I'm normal.
Napenda tu kuambia watu wanisaidie nipone. Taweza kutembea na niendelee na maisha poa.
Things are not falling apart for Lesley. They're not standing as they should. But with the surgery, she can reclaim her childhood. Dorcas Wangira, Citizen TV, Nairobi.
The way to be is to make someone happy. Living down here.